I'm Dr. Jerry Hesch, a physical therapist who works at Hesch Institute in Aurora, Colorado. And this is a brief interview of a client who presented with a left side bent coccyx, which I treated. And so Ellen is going to tell us a little bit about her history, and then she'll tell us about her response to treatment. And the treatment that I performed was a very gentle, small amount of force applied to the ligaments on the right side of the coccyx. And we did that for 5 minutes. Very gentle force, 5 minutes duration, and then we pushed directly onto the coccyx and of course captured some of these ligaments on the left side, pushing it to the right. And diagnosis is critical. Treatment is very straightforward. And so I'm going to preserve her privacy, and I'll just point the camera to the anatomical model. And Ellen, can you give us a little bit of history?
Yes, so hello. So my coccyx has been bothering me, so it's July of 2018 right now, and it started bothering me probably around April or so of 2017, maybe March. I just noticed it one day. And I kept thinking it would go away, Well, it didn't go away, and it kept getting worse. So I went to a chiropractor. That did not help. I went to a couple of chiropractors, one of whom did acupuncture and a very powerful TENS unit. I've gotten numerous massages, and just nothing has helped, literally. So I happened to stumble upon Dr. Hesch, and I have, during this treatment, I am speechless. I can't even get the words out about the difference that it has made. I'm able to sit and without pain, maybe a little tenderness, but nothing like I had before. And getting to a standing position from a seated position used to be so excruciating. I had to use my hands and move very slowly to get up out of a seated position. And actually, probably we should film this. But now I can literally just stand up. A little help from my arms, but not like I used to. I don't know if do you want to film that part? Like the difference?
Sure,
Okay.
sure.
Hello. So this was me standing up an hour ago. I had to do this whole maneuver to stand up. Okay? I could not have just sat down the way I did. I had to move very slowly. I just sat down. This is me standing up now. Little weakness in the legs, but literally, I could not do this 1 hour ago.
Nice. Excellent.
So
I'm very encouraged.
Oh my gosh, I can't
I
believe
think,
it.
I think there's a lot of side bent coccyx that do not get diagnosed.
Oh, and one thing I forgot to mention, I went to an orthopedic specialist, had an x-ray. He did say that the coccyx was bent to the right, and his solution was to remove the coccyx.
Interesting.
Just cut it out of the body. We don't need it, he said.
Interesting.
So I'm not saying that, he was wrong necessarily, but it wasn't necessary. This was one visit.
Yeah.
I have not smiled like this for months, so.
Nice.
Yeah.
Well, your coccyx certainly did not feel unstable to me. So I'm confident that over the course of 6 to 12 weeks that the residual pain will abate, and it should heal up, and it should serve you very well. Based on everything you're telling me and how it's behaving, that's my conclusion.
And for people who are listening as well, it wasn't just this sofa. I tried 5 different chairs.
Yes, in my office. You sat on my office chair and the stool.
The living room chair, the stool. I tried everything. I didn't want it to just be like, oh, okay, it works for this one chair.
Very good.
It worked.
Well, I have several other YouTube videos on coccyx pain and several others on side bent coccyx as well. And I'll continue to post some helpful videos on the subject. But I guess my advice to anyone with coccyx pain is make sure that someone specifically knows how to evaluate for a side bent coccyx. And if the clinician doesn't know how to treat it, they can contact the Hesch Institute, because we have a whole body, we have an advanced video which covers treating the sacroiliac and treating the coccyx as well. And we do teach clinicians how to do that. We have a home study program. But anyway, I'm kind of raising the freak flag and saying, hey guys, there is a side bent coccyx pattern, and it's usually very responsive to external treatment. The secret is small force, long duration, 5 minutes of pulling on one side and 5 minutes of pushing on the other side. And there is hope for people with side bent coccyx. Thank you very much for your feedback.
Thank you.
And then we'll film additional when you come back.
Okay.
We'll do a part 2. Thank you very much.
Thank you.